Hey, welcome to episode 283 of the Dental Marketer Podcast. I am your host, Michael Arias, and thank you guys so much for tuning in. I truly appreciate it. Don't forget, really quick, I just want to let you know that this podcast does have its own Facebook group. It's called the Dental Marketer Society. I'm going to put a link to that in the show notes below in case you want to speak to the guest a little bit more, continue the conversation after the podcast episode is over. That's where it's happening, in the Dental Marketer Society Facebook group. So that's going to be in the show notes below in case any of you guys want to join. But in this episode, I speak with the wonderful Dr. Yoshita Patel, and she has such an amazing story, a great story. She's a mentor to a lot of you guys. I know that she's taught a couple of the guests who have been on this show. And she has a fee-for-service pediatric dental practice, and she gives us a lot of advice in this episode. One of it is how she never assumes what someone can afford and what they value. As soon as we start putting assumptions on someone, right, based on their appearance, based on what they're saying or something, right? Maybe the conversation, you're like, oh, you know what, they said this about this, so maybe they probably don't have money. We're assuming already. And that's going to cost us in the long run. So never assume what someone can afford and what they value. We also discuss about being helpful. Understand that your office is not for everyone, but don't just leave it at that. Be helpful. And her practice literally, they practice what they preach. They are extremely, extremely helpful to the community. Even if, for example, like the new potential patient goes to their practice and then it's not a right fit, they guide them to the right fit. And some may say, okay, that's a waste of time, but no, being helpful is never a waste of time. And you guys will see why in this episode. We also discuss what did she reinvest in instead of paying herself throughout the first couple years. And we also discuss how does she structure her bonuses. I know this is a hot topic around this time of the year, especially, you want to give out like Christmas bonuses and things like that. But we discuss how she structures her bonuses according to each person. So we discuss this and so much more. I'm so excited for you to listen to this episode. So without further delay, here is Dr. Yoshita Patel. Really quick, do you have a nickname or anything like that or no?
My friends call me Yosh.
Yosh. That's cool. Yosh. Okay. Could it be okay if I maybe...
Absolutely. I'm not used to people calling me Dr. Patel anyways.
How weird would it have been if you're like, no, Michael, Dr. Patel. I'm like, oh, okay. No, but awesome. So then, if you can, really quick, tell us a little bit about your past, your present. How did you get to where you are today?
Sure. So I grew up in Cleveland, Ohio, and I went to Case Western for undergrad, and I was an anthropology major. So what a natural segue to dentistry that was. So I had like zero prereqs for dental school. So I ended up going to a baccalaureate program at Penn, and after that applied to dental schools. And I got into the University of Michigan and decided to attend there because it was the cheapest school I got into. And it was a great school. So I ended up there. I met my husband there as a D1 student. So I was one of those D1 couples that ended up getting married right after dental school. And I went into dental school thinking I wanted to do pediatric dentistry, but I wasn't certain of whether I would get in and how competitive it was. And I looked around at all of my classmates and I was like, they're so much smarter than me. Like, how would I ever get in? And so I didn't apply. So then I did a GPR because I had a passion for special needs dentistry. And I ended up doing a GPR in Madison, Wisconsin. And during that time, my husband was doing an AGD in Texas, decided to apply to endo. And so he matched an endo in Texas. So I moved down for him. And then I decided I wanted to do pediatric dentistry. So I applied to pedo. So we were perpetually in school and residency at some point. At the end of my pedo residency, I decided I wanted to start a practice. And at that time, we were kind of looking for places to be. I thought maybe Texas was where we wanted to end up. And then we had a baby, and we decided that we wanted to be closer to family. So then we looked to where my parents are, and it's Viera, Florida. It's the east coast of Florida. It's basically the opposite coast of Tampa. And we really liked the area. There was an opportunity for my husband to join an endo practice. And I looked around for pedo opportunities and there weren't any, so I decided to start my practice. Mind you, we had a 6-month-old baby, so it wasn't the best timing, but it was the right time for me to pursue what I wanted to do and practice the way I wanted to practice. And so that's my story in a nutshell.
Wow. Okay. So then let's rewind a little bit. You
Sure.
went from anthropology to why such a drastic transition there?
I had no idea what I wanted to do in undergrad. But what I knew is that I loved people and I loved the idea of health and culture. And it was medical anthropology is what I ended up majoring in. And it's just the study of health, disease, illness in a variety of cultures. And I thought it was just super intriguing. And I didn't know I would do with that degree, but I just knew that it was something that I really wanted to learn more about. And so that's kind of where that came in.
Okay. And then so then you immediately were like, okay, never mind. I want to do dental. Like that or
Well, you get that the question from Indian parents is always, what are you going to do with that degree? And so I said, I have no idea. So they're like, well, you need a real degree. And my family is mostly physicians. And my father's a physician, my brother's a physician. And I thought I wanted to do medicine until I lived with my brother when he was in his intern year of residency. And I was my senior year in college. And I saw his life and I didn't like it. I didn't like the idea that I saw him every 3 to 4 days, even though we lived together. I didn't like the idea of, not being able to spend a lot of time with my family. There's a chance of that. So I started looking at other options, and a couple of friends of mine were pre-dent. And so I looked into that and I shadowed a little bit. And I was like, yeah, that actually sounds like exactly what I want to do. I get to work with my hands, be a little artistic, and also speak directly to patients and use my anthro degree in some way and learn more about where people are coming from and how they view, dental caries and disease and, how different cultures value it and may not value it and, that kind of stuff.
Awesome. Okay. So then we fast forward. You went to dental school. You saw D1. Now this is more for your husband, but did you see him and you were like, yes, thank you. This is totally worth it. I'm going to be here forever now because of him. Or were you like, hey, what's up, dude? And then you guys ended up liking each other.
It was study buddies. We were a group of friends that studied together. So yeah, our dates were at the library. We started hanging out in anatomy lab over cadavers. So it was really romantic.
Wow.
And then we would just went to the library and hung out as a group of friends, and then just kind of a natural progression from friendship to more than that.
That's cool. That's really, really cool. Do you feel like this, because I feel like some dental students are like kind of in the same position. Do you feel like that helps out or that kind of distracts, or what do you think?
I think it helps when your significant other is just really smart. I picked a good one. He's very humble, and he would never tell you anything about himself to be boastful or anything. But he's one of the smartest people I know, and he's very skilled. Technically, I think he had the highest grade in our clinical dentistry course at Michigan, which again he wouldn't tell you, but he was just really good. So I mean, he pushed me to be better, and I think that's what attracted me to him in the first place. And I think that's in a spouse what you're kind of looking for, like someone who's going to make you better and aspire to be better. And he makes me do that in my personal life as well as my professional life. So I really think that he's a strong motivator in all aspects of my life, and I'm really lucky.
Gotcha. Okay, and then we fast forward a little bit more, and then if it wasn't for you guys, like let's just say no baby was coming, would you have stuck with Texas then?
I think some people are just meant to be in Texas and some people aren't. And I'm not one. I think Texas just wasn't home for me. It never really felt like home. So I think eventually, I think we would have left. The opportunity here in Florida was just really hard to pass up for both of us. And I think that just being around family was important. I think we may have ended up in Michigan instead because that's where his family is.
Mhm.
I always told him that if the University of Michigan called me and said, "Hey, we want you to work as faculty in the pediatric dental department," I would totally move there in a heartbeat to Ann Arbor because I loved it. And it's funny because 3 weeks after I opened my practice 2 years ago, I got a phone call from the program director of the University of Michigan asking me
No.
if I wanted to be a faculty there. I was like, well, call me in 10 years when my lease is up.
Wow. Okay. I was
But
gonna ask you
yeah,
that, like, would you do it now? But no, you already have the practice. Okay, cool. So
yeah,
then let's get into, if it's okay with you, can we get into your business now?
sure, absolutely.
Awesome. Okay, so then right now you have, it's not an acquisition, right? You started it up from scratch?
Yeah, start from scratch.
Okay, and then who did you go with for like the bank loan?
Bank of America. I actually put out feelers to Live Oak Bank, Wells Fargo, Bank of America, and local banks just to see what rates would be for a startup loan. And 2 years ago, or I guess I started the process almost 3 years ago. Bank of America had the best rates. So I went with them.
What was the rate that you got it at?
Oh gosh, now you're asking me questions I don't remember. um, I can't even remember. I think it's like 4 point something.
Okay. Do you remember how much the loan was for?
Yeah, I was like 525.
Okay, wow. Okay, so then, and then you spent, or let's just talk about it all. Like, so then what type of practice do you have? It's a pedo practice. How many ops do you normally have right now or currently have?
So I started with two hygiene and one op. I'm a little bit different in that I'm a fee for service pediatric dental practice. So I'm completely out of network with all policies. So my vision for my practice was if I'm going to build my practice, I'm going to practice exactly the way I want to and spend as much time as I want to with families and practice at a fee schedule that I think is fair. And so I ended up just opening fee for service from the very beginning.
Gotcha. Okay, so then how scary was that in the sense of like, hey man, I ain't going with no insurance, and there's people probably next to me who are, you know?
Well, I think I guess I didn't realize how dumb it was at the time, or how foolhardy I was, or how hopeful I was. But it worked. I mean, I think when you believe in what you're doing and you do it with, I guess, what is the word?
Like
With your
grit?
heart,
Oh,
your
heart. Uh-huh.
grit. Yeah, I mean, I believed in what I was offering. I knew that what I was offering was different and that people were looking for that level of service and care,
Hmm.
um, and that it was needed. And so, there's not a ton of pediatric dental offices in my county, but there's a few. And they take insurance, and I think that's great. They do a great service to the people that, need to see people like that. But I think there's always a space for a fee for service office in most communities. I'm in a wealthy area, probably the most wealthy area in the county, which helps.
Hmm.
Um, but I have plenty of Medicaid patients that pay cash, and I have people who make it work. Um, so I guess one big thing that they taught us at Michigan was you never assume what someone can afford and what they value. And
Hmm.
I think that that's a really big lesson in assuming that someone can't afford you. But if they value you, they're going to pay for you, just like they're going to pay for that next iPhone 12 Plus or whatever they're coming out with.
Hmm.
If that's something you value, you'll make it work. And that's what I've seen in my practice is that people will go get second opinions, and I send people to other places all the time, just because I feel like maybe you should talk to somebody else and maybe it would be less expensive. But a lot of them end up coming back because they appreciate being treated with respect and kindness and being able to spend a lot of time with the doctor. I schedule an hour for new patient exams, and I spend in almost the entire hour with the family reviewing things and spending time with them, making sure that they're involved in their kids' care. And I think that people come to value that and appreciate it. And I just believe in that method of practice.
Got you. Okay, so then originally, let's just say I'm bringing my kid to you. I want an
Hmm.
exam, and I guess like
Hmm.
they're starting school. I want an exam, right? And
Yeah.
normally, how much do you guys charge for that?
Oh, let me check. I just went off of the fee schedule that Henry Schein gives you, and I kind of stayed in that 50 to 60% range for my area.
Oh.
So when someone calls, there's a printout that we have for all my front desk staff, and we say straight away, we are out of network with all dental policies. If it's a PPO plan, we'll file on your behalf. And, as long as people are okay with us being out of network, we will go ahead and do a predetermination of their fees ahead of time. So right now we're booking out a few months. So we have plenty of time
Wow.
to go and do a predetermination for a family. So we get all their insurance information, get it into the computer, and we send a predetermination right away. And within a few weeks, we know exactly if they have an out of pocket expense and what it would be. And so that's helpful because then we can tell, families, okay, well, this will be the cost. And if that's too much, then we say, there's these other offices that are in network that will help you. And that's a big part of our office culture is being helpful because our office is not for everybody and we understand that. And so if somebody calls and says, do you accept Medicaid? We say, no, unfortunately, we do not, but these offices do. And so my staff will take that equation out of that person's head of where do I go next and go ahead and give them the answer. And so we refer regularly to our colleagues in town. If that's what people are looking for, we think that'll be a better fit for them. So I think it's really important to be helpful to the people on the phone because they don't know what we know and why not share it with them?
You know what? You just literally right now lit a light bulb in my head because like I never until now I never noticed like I normally go with the people who were helpful even though I'm like, hey, and then they like help me out through like whatever, right? Let's just say I need to get a procedure done, and then they help me out, and I'm like, oh, that's kind of too expensive. And then they tell me other people, and then I talk to the other offices that they referred, but they're not that helpful. You know what I mean? They're not that great. They're just like take it or leave it.
Right.
Then I'm like, you know what?
Yeah.
I feel most comfortable with the person who was helpful. Like I really enjoyed that. I don't care paying
Yeah.
a little bit more. Wow.
Yeah, exactly. And, I always review with, patients at every new patient exam. Like, I'm on call for my patients. If you are my patient, I'm there for you. And I can't tell you how many texts I get every week from parents that have questions or concerns. It's kind of like a concierge dentistry type of setting. But
Mhm.
I think that they're paying for it. They're paying for me to be available, and I'm happy to do that as a parent myself, if I basically created a practice that I would want to take my kid to, and be the provider that I would want for my own child. And that's kind of how I've based my entire practice is what would I want? What would I do for my family? What would I expect of a provider for my child if they truly cared about my kid? And so
Mhm.
that's just kind of my vision for my practice.
Do you feel like that might become too much though? Do you ever get burnt out like doing that?
Honestly, no. Right now, I'm burnt out because my husband is also building his practice within mine, and so we're doing two startups in one.
Oh, wow.
But no, I love my job. I truly am passionate about what I do. I enjoy it. I really just love my job, and I never come home feeling like, "Ugh, I don't want to go back tomorrow. Because I think when like my hours are exactly what I wanted. I've built the practice that I dreamed of. I work 8 to 3. I work through lunch. I have time with my children. I have time with my husband. I have time with my family. And I have time with my patients. Like I'm really not giving up anything in order to work. And, for the past 6 months, I had a baby in May. And so I went back to work 5 days later. And I took her to work with me. And so the last 6 months, I've spent every single day with my baby at work. I mean, it's like the dream job.
You went to work 5 days later after bringing life, a new life to the world. That's what you did?
Yeah. Yes.
And you didn't ever think like, I can't believe I'm doing this. This is
No,
for
because
real.
I had my first when I was in residency. I was finishing up residency. And at that time, I was told that either I had to take my vacation time and whatever time I wanted for maternity leave and then come back and finish. but I was literally like 2.5 weeks from graduation. And
Mhm.
so I decided, nope, I had the baby on Friday and I went back to residency on Monday to finish whatever I needed to finish in order to just be done. And so with my firstborn, he was at work with me 3 days after. So I I knew it was
Wow.
possible.
I knew by days. Wow, man, that's amazing. That's really awesome. So, okay, I want to rewind a little bit and ask about predetermination. You send your patients
Yes,
to predetermination. What is that?
yes. So, insurance companies, when you're out of network or in network, you can send in what's called a predetermination. So, you create a list of codes that you're going to plan to bill out for this patient. Say it's like 3 crowns of filling and cleaning and exam. So, you'd put all those codes in a form, you send it off to insurance, and then they'll evaluate it. It takes about 4 to 6 weeks, and they'll return that form with the coverage as an out of network provider for those fees given your fees. And so instead of saying like, oh, we'll cover 80%, they'll actually give you a dollar amount. And even then it's still an estimate, but still it's like a good idea of, okay, well, your dollar amount that you'll owe us at that visit is this, and your insurance company will pay us this. And so it's a very clear and an easily accessible document for any practice to do for out of network
Got you.
patients.
So you do this, you determine, like, let's just say, okay, they're going to pay out of pocket $30 and it's the insurance
Mhm.
covers 100, right? Let's just say that.
Yeah.
And then you will charge 130 or 100, or how much would you charge?
So what we do, if the fee is $130, it depends on the insurance company. So like Delta Dental, for example, has a variety of arms, like Delta Dental of Washington.
Mhm.
So for us, our fee is the same no matter what insurance company it is. The only thing that varies is the out-of-pocket expense for the patient. So if their out-of-pocket fee is $30, it depends on where's the check going to go? Is it going to go to you, the subscriber? Or is it going to come to my office? And so if it's going to go to the subscriber, we charge 130 up front. We let the family know you'll be receiving a check for $100. You can cash it and you're good to go. Otherwise,
Mm.
if the check is going to go to them or to me, we just collect the $30 and then we just accept the check when it arrives.
Oh, okay.
So
That's
my
pretty cool.
fee schedule is the same for every single person, whether you've got Medicaid, whether you've got, any PPO or HMO policy, my fee schedule does not change.
Got you, got you. Okay, so then that now for the people who are listening and then they're like, that's great, Yoshida, but we're not booked like, 2, 3, 4 weeks out. We need like a new
Hmm.
patient tomorrow, and then this happens. What would you recommend? Should they still get a predetermination like at that moment, or
It just depends on, expectations of the family. I would say if they need to know that in order to book with you, then I would say definitely do it and book them 4 weeks out and just let them know we'll call you a few days ahead of the appointment when we get the predetermination and let you know, and you can make the decision then. Like at the beginning, we weren't able to do that. I wasn't booking 2 months out at the very beginning. And we just collected up front at that point and said, this is how much it is. And it was a lot of trial and error and changing fee schedules based off of reimbursements, and communicating back and forth with families, especially at the very beginning. Like I've got families that have been with me now for 2 years, and there were hiccups, and they're like, well,
Mhm.
that's way too much. I've got 4 kids. How am I going to pay $800 for new patient exams and panos? Like that's a lot.
Yeah.
And so, being at a network, you can kind of do what you want. You can change your fees the way you want to, write off whatever you want to, because you're not obligated to an insurance company in order to, participate in their plan. You have to collect all copays. There's nothing like that with out of network. So I feel like you just have more freedom as an out of network provider to practice exactly how you want to practice. And there's plenty of times where, a patient can't get x-rays from previous office. And I just say, okay, well, let's just no charge x-rays and take them. I'm not worried about getting every penny from insurance because I'm just practicing the way I think it should be done.
Yeah, I like that. Okay, so then if okay, so then that's basically the whole thing about with fee for service. Now, when it comes to
Hmm.
when you were open for like the first year, because this is year
Sure.
3 almost, right?
This is the end of year 2.
End of year 2, coming into year Okay. So then on your first year, talk to me a little bit about how it was like opening day, the first month, second month, third month. Was it like this poppin'? Like, did you guys do amazing or?
So I was breaking even by the end of month 3.
Oh, wow.
Um, and then I was able to take a paycheck probably month 4 and 5, but decided to just reinvest in the practice instead of taking home a paycheck. So I ended up buying a laser to do infant frenectomies for people, for moms with difficulty with breastfeeding. So I just kind of reinvested where I thought I needed to. And I was very fortunate to have my husband working at the time. So taking a paycheck for the first year was basically moot. Like I didn't plan to.
Mhm.
Um, and so, I just, for the first 3 months, I saw maybe 1 to 5 patients a day. There were days that we had 0 patients, but I used that time to work on systems and procedures for the office to ensure that, we had a powwow after every patient encounter as a team and just said, what could we do better? Where are we lacking? What do we need to look into to make things more efficient? And I emailed every single patient after the appointment and said, please let us know how we can improve. Your feedback means a lot to us. And, we want to be better every day. And I think that resonated with families. When you truly care about what you do, I think it shows.
Yeah. Yeah. Especially if like you emailed them back and you told them that, I think anybody would be like, wow, she really, you know what I mean? Like she's the one who actually emailed me back and talks is wanting to know more about just everything. So I think that's really, really good. Now when it came to you guys, I think you said you were bringing in like 3 to 4. What do you do? What's different now? Like what are you doing now for marketing and advertising?
Honestly, not a whole lot. And I hate to tell you that because of who you are.
Because
Like embarrassed to tell you.
it's okay. It's okay. No, uh-huh. But
It's
what are you doing?
mostly word of mouth and Google reviews. That's pretty much where we get most of our patients. It's pretty much it. And I give, I guess, my marketing dollars I give towards charities and local groups that are trying to raise money for local efforts. But
Mhm.
I really, the ROI, and that's abysmal. Like I don't really get anything out of it. It's not really marketing. It's more of just community service.
Gotcha,
Um,
gotcha.
I
Okay.
do under 3 exams I do for free because I was noticing that a lot of providers are a little bit more old school and they're telling parents like, oh, you don't need to go see a pediatric dentist or a dentist until age 3 or 4. But then I was noticing a lot of my sedation days were 2 to 4 year olds. And so I decided to do under 3 exams for free so that, the kids that are at high risk aren't losing out on preventive care. Um, and so I still do that. I do under 3 for 3 as a community service for our community.
And so you really pay close attention to the needs of the community, right? When it comes to like that, I mean, doing the getting the laser for the frenectomy for the moms who are having difficulty with breastfeeding. I mean, and the concierge dentist. Sounds to me, at least, right? Like you really are paying close attention to the details of the community.
Yeah, and that's important to me. I think as an individual, I feel a sense of obligation to the community that I serve. And I try to be aware of the needs of the people around me. And if I can help, I will help. So, there's been families that, for example, lost their home in a fire, and as social media, I have a reach and I have a power to reach people in the community to ask for help. And especially in the area that we live in, we're all very fortunate. And I can't tell you how many people just walk in and like, here's a donation, here's a donation. And we've done that so many times for people in need. And it's amazing the willingness that people have to give and especially give during a pandemic.
Mm.
And so I try to be involved in the community in that way in my, community of my own clinic, and I don't know, I feel like it's my little family. I want to take care of them.
Yeah, that's cool. And then, so right now, how many new patients are you currently getting monthly?
Um, it's somewhere between 90 and 120.
Oh my gosh. Oh my God. And then how many Google reviews do you have?
Let me check. 489, I think.
Oh my. And how you're just getting these reviews by naturally asking, or do you have like a software?
I use Swell, but it doesn't integrate with my software, so we just input their information into it, and but Swell's been great.
Yeah, Swell's pretty awesome. So, okay, through Google reviews and referrals, and now when you're getting these referrals, are you asking them like actively, like, hey, bring me somebody, or what are you normally doing?
No, they just call and say we were referred by so and so.
Because of how awesome you guys are, basically, right? Because of that. Man, that's really cool. So you're bringing in 90 to 100 new patients. Did that dip at all, like after the restrictions were lifted?
No, no, not at all. I think my slowest month was May because that was the shutdown for all dental offices
Yeah.
in Florida, and I also had the baby. So, I think that month we had 80,
Gotcha.
but
Okay. But
no,
it's
we
been
didn't
good.
really slow down. Mm-mm.
And then how's your treatment closing rate been, especially since your fee for service?
No, that's the tough part with pediatric dentistry. I think it's always a little bit lower.
Hmm.
I'd say right now it's at 70%. Um, but with pediatric dentistry, we're not really selling anything. We're just telling you, hey, your kid has a cavity, you need it fixed. And
Hmm.
so some people will say, like, well, I can't afford that. And then I'll refer them elsewhere and I'll just say, I think this other office would be a better fit. And I just go ahead and send their x rays to that office right then when they're sitting there. Or if they're a Medicaid patient, there's a Medicaid clinic that does IV sedation and treatment for free. So I'll go ahead and send those patients straight to that clinic. So there's a lot of screening that I do to find the right place for people, and just listening to their needs and listening to, where are you financially? What can you handle? On occasion, I'll do payment plans for families if I know and can trust them. But that's not common.
Yeah.
Um, but yeah, I mean, there's not a lot that I feel like I do differently than anyone else, to be honest.
Hmm. Gotcha. Okay. And then so for right now, I know you guys were saying, or you were telling me how at the beginning, right, you would email the patients and say like,
Yeah.
what can we work on and things like that.
Mhm.
Do you have any systems that you've kind of created in your practice that are like really unique or you're really, really proud of?
I'm proud of my staff. I think that they have taken on that office culture and really looked at our core values that we have, that I have them listed on the website because I think it's important that people know that we take them seriously. And I think just having a great flow and being efficient and respecting people's time. We run on time all the time. Um, they're compassionate from the first phone call to, when we graduate a patient to a general dental clinic. People are compassionate, they're kind, they don't rush people on the phone. We've plenty of, stories of like grandparents who have inherited the grandchildren because of something that happened with a parent. And I have had staff spend 45 minutes on the phone with these people because they just need someone to talk to, and
Hmm.
I think that's important. I don't ever tell them like, hey, you need to be fast. You need to be like take your time, spend time with each individual, be empathetic, be compassionate. And that's stuff that I don't have to teach people because hiring the right people I've been very fortunate in hiring the right people. Um, and so I think
Hmm.
that's my star power is my staff and just being able to count on them to ensure that a patient and parent is going to feel well taken care of. And I think especially during COVID, even as adults, we want someone to take care of us, right? Like we want to feel comfortable and safe. And I think my clinic offers that. And, just today I had a parent who the mom in the notes it said, please talk to mom before taking x-rays on the children. And so I
Hmm.
just talked to her very briefly and I said, I saw that you had some concerns. Can we talk about them? And she said, yeah. And I said, well, I think both of your kids need bite wing x-rays and an upper occlusal x-ray. And she's like, okay. And I asked her again at the end, I was like, are you comfortable with the x-rays that we took today? And she said, and she just broke down and she's like, well, my husband had a brain tumor last year and we're just trying to be really cautious with radiation. And like, I mean, there are tears from all over the place. Like I was crying, she was
Yeah.
crying. And I think just sharing in those moments of like being human, is something that is important to me, and seeing a
Hmm.
parent for we all have guilt. I don't know if you're a parent, but like there's things that we mess up at, and we would just want someone to identify that like you're okay, you're doing okay.
Yeah.
And I think that's something that resonates with a lot of young parents right now. And when they come in and you tell them kid has 16 cavities, like that's not easy to hear. And so
Hmm.
I think having a non-judgmental forum in which they can feel what they're feeling and talk to someone who's not judging them, I think makes them feel safe.
Yeah. Yeah, you're absolutely right. And then so you spend an hour with new patients, right? You said, uh,
Yeah, about an hour.
and you're getting 80 to 100 new
Hmm.
patients a month. That's to build relationships like that. You know what I mean? You really gotta love people, man. You like
I
families
love
and everything.
people.
Yeah, which is cool. It's good. It's good. And then you said you hired the right team. Was it you hired them off the bat? Like it was perfect already, or no? You had to let someone
Oh
go.
gosh, no. Oh no,
Oh.
no. Lots of trial and error. I have two staff members that I hired pretty much off the bat, my two assistants. Um, and they're fantastic. And then my front desk staff, I've had one that's been there for over a year, and the other has been there for about 3 months, 4 months now. Um,
Mhm.
and there was some trial and error. There's some people that left due to health reasons and things like that. But ultimately, like I used Samantha Leonard's
Mhm.
company, Stream,
Uh,
and she's been a fantastic resource for me as far as just talking to somebody about how to do all this stuff. I mean, you can't be good at everything. And I think a big part of having a startup is knowing your limitations and finding the resources to help you learn how to do things that you're not good at, or just farming them out if you're not good at them at all. And HR is something that I think people don't spend enough time and effort on. And I'm really grateful to Samantha for talking through things with me at the very beginning so I can kind of learn how to do things and document things and all of that. But I use a lot of the things that she and I discussed at the very start to interview and find the people that I found. And I always keep resumes on file of people that I think would be good. And if I'm looking for someone, I reach out to those people first, and then I move on and start posting after that. But I've been really fortunate with the people that have been attracted to my practice and have reached out
mhm.
to me directly.
That's awesome. So then throughout this whole process, from like the moment, honestly, from the moment you signed the lease to that you wanted to be or a practice owner, you wanted to do a startup till
Mhm.
today, right now, what
Mhm.
have been some of the biggest like struggles or fails or pitfalls that you've experienced?
I think that's a tough question. I think they change. I think
Hmm.
that the struggles change with where I'm at in life and also in practice. I think initially just getting a foothold of clinical dentistry, doing it the way I want to, and finding the things that work for me personally, and then how to manage staff is always difficult. I think it's just how do you keep them happy, but also be true to yourself and not give too much. That's been a struggle for me. I think is just letting people not take advantage of my good nature, and that's
Mm,
something that I kind of upfront told my staff, like, please don't take advantage of me. That's when things go south. If I feel that you are just taking advantage of me, then we're going to have a discussion and that's where things end, you know? And I
mhm,
think that's just being open and honest with them about, this is who I am and this is how I practice and this is what I want out of you. That's worked well for me. But there's still days where I feel like, well, I wish that they they took their job more seriously sometimes, or they understood the trials and tribulations of being a practice owner and how difficult it is to watch if somebody cancels, and you just got staff sitting around.
yeah.
There's only so many things you can tell them to do on downtime.
Mhm,
And have downtime lists. And I have a bajillion checklists that, my staff follows if there's downtime, or, monthly, weekly, daily checklists to check off on so I can see who's doing what. I think that's hard to see. Like recently because of COVID, and I think parents in general are just less responsible at this time. Um, I've had
Mhm.
a couple patients who no-showed, or one patient that no-showed twice for hour blocks, and now we've got a wait list of 2.5 months. Like it just hurts because you're like, oh, I could have seen two kids during that time. And, I
Yeah.
wish that they would have just called and said they're not coming, or they just don't realize how important it is to keep an appointment. So, those
Mhm.
trials and tribulations of like no shows and how to avoid that, when's best to send a text reminder or an email reminder, when do you call them? And, finding all those little systems that work in our community. It took some time. It took me 2 years to get to that point of here's the formula that we're going to use of text reminders 2 weeks before, 5 days before, the night before, communicating protocols, making sure that they know that one adult is only allowed, and we take temperatures and this and that. Like it's been a really crazy year as far as changing protocols and updating things. And I think everybody's feeling it in every aspect of their life. And so, for some
Mhm.
people, they just need to be given grace, and other people just need to be dismissed. And I think that's hard as a practice owner to just be like, all right, well, I'm not going to see your kid anymore because you as a parent are irresponsible. I think that's really hard for me.
Do you, so throughout this time, have you had to fire a lot of patients?
Patience, no. Um, I have a bleeding heart for patients. Because, ultimately, who's losing? The kid,
Yeah.
Like they can't pick their parents. And unfortunately, if they call, I'm going to see them, but I've learned as far as I'm going to have them pay up upfront over the phone, and we bill that credit card immediately once they hang up. And we'll see them only if they've done that. So,
So
we've come up with protocols to help with that
you have them pay up front over the phone?
sometimes.
Oh, wow. That's really cool. And then,
Yeah. If they've no-showed multiple times, I have it in there. Or if they've only no-showed once, I have my staff just take a credit card, and they sign it, and we send them a sheet that says, this will be charged before the visit, and if I no-show, then that will not be refunded.
gotcha, gotcha. Okay. So that's throughout this time you haven't fired up. But have you let go of someone throughout this time? An
Like a
employee?
patient, an
No, an employee.
employee.
Yeah.
I've been fortunate in that they kind of let go of themselves.
Uh-huh.
It happened where, I've written up people a few times, and then they decide, what, this isn't working for me. And they just hand in their notice. So fortunately, I haven't had to have that conversation directly and say, I'm sorry, this isn't working, because it kind of worked itself out. Um, but I'm certain I'll have to do it at some point.
When you tell them like, "Hey, I'm writing you up," and these things like that, and then they decide to leave,
Hmm.
what what disconnect do you start seeing from that point on? Like, if other people are listening and then they're like, "Okay, you know what? I'm experiencing that too right now. Like, I've written somebody up and it looks like they're carrying less or something like that." You know what I mean? When do you start seeing the disconnect?
So generally, it- the write-ups I've done are arriving late to work, cell phone usage, things like that. But the big ones are more attitude oriented, of talking back or disrespect towards me or another employee. And I don't let that stuff go. When I hear it, it's written up immediately.
Hmm.
And I think that serves two purposes. One, like, hey, I'm taking this seriously. And it also, I think most people don't want to be told you're doing something wrong. So, whenever I've written someone up, I see an immediate change. And if I don't see an immediate change, that's when I would start to say, okay, well, you've been warned and this happened again, and it's time to go. But again, I've been fortunate enough where people decide, okay, well, I'm going to shape up because I really like my job and I don't want this to end.
Hmm.
And the one person I had to write up a couple times, she just became very disrespectful, and it just ended up that she was like, well, this is no longer a good fit for me. And I said, well, good, it's not for me either. And she just gave me her 2 weeks notice. I kept her the 2 weeks, and then she left. um, but I haven't had to fire anyone outright.
Yeah. But no, I get you. It's such a hard like medium to find. Like, I don't know. I don't know if Do you watch The Office by any chance?
I love The Office.
Okay. Okay. So I don't know how to find the medium of being like Jan or Michael Scott. You know what I mean? Like I'm either Michael Scott all the way or I'm either like pretty straightforward and me. So I don't know how to find, you know what I mean? Like what you're talking about in the sense of, and I know a lot of people are like that. I know Ashley kind of feels like that a lot of the times too, where you want to open up to your employees and they treat you like, oh, hey, what's up? We're going to go out for a drink. You want to come? Yeah, let's go. All right. But then it's like, where's the line? You know what I mean? Of like, hey, I'm your boss, or I'm the
Yeah, and I
owner.
think they all know that I'm the boss, and they treat me with that level of respect. And I feel like I don't socialize with them outside of work. I honestly don't have the time or the energy to, but they don't
Mm-hmm.
either. I think there's some people that want to go to work and go home and spend time with their families. And I think those are the type of people I end up hiring, is people who just they come to work because they want to obviously make money, have a good place to work, a good work environment. But ultimately, all of our goals is to go home and spend time with our kids. And I think
Mm-hmm.
because of my hours of 8 to 3 and staying on time, like most everybody's out the door at 3 o'clock, staff
Mm-hmm.
included. And I think that's attracted this particular type of employee that values that time with their family and values just, we have one outing a year as a group. Like last year, I rented a limo and we all went downtown to Orlando and we went to Dueling Piano Bar and we went to dinner and I hung out and it was super fun. But that's
Mm-hmm.
once a year. I'm not trying to be someone's best friend. I want to be the boss. I don't want to be in that position where I'm constantly struggling between the two.
Gotcha.
So I've intentionally left that divide there
You
because I
hired the
think
right
that's
people.
important. Yeah, and I think having that division is important. I know, there's the group Mommy Dentists in Business, and they a lot of women I think struggle with that duality of being a friend versus being a boss. And I think the most successful ones that I've seen that have that work life balance and work environment balance maintain that they are the boss. They're not anybody's friend.
Mm-hmm.
And, I think you have to be that way in some ways. And it's hard because, your group of girls or, you want to create a great workplace environment. But to me, professionalism is first and foremost. That always comes first. And yeah, during downtime, do we talk and we hang out and we laugh and stuff? Yes, but productivity is not lost. And that's always at the forefront of everybody's mind, and shared profits, like if we're not busy, then bonuses are limited, and I make it very clear, like the more productive we are, the more we reach our financial goal, that more I can share with you. And I do. I'm very generous with my staff. We buy lunch, I give bonuses, if I see something great happen or they do exceptional work or they go out of their way to help, they're given bonuses right away.
Hmm.
Um, and I think that sense of appreciation goes both ways, and I think that they see that I do appreciate them. Honestly, I appreciate them every day. And I tell them please and thank you. Every time they give me an instrument, I'm saying thank you. Like that's just part of who I am. And I think that they sense that. So I
Yeah.
don't know. I think it's just creating that culture and vibe and the duality of, your role as a business owner and as a boss. I think it's important to have a little bit of separation.
How I know you mentioned it right now. How do you give out bonuses? Like how do you structure the bonuses?
It's just however I want. And there's not really structure. Because I mean, I don't have hygienists or anything. So, if I see someone, you know, like I had a staff member who went out of her way to go and deliver stuff to referring offices. And I said, well, thank you so much for doing that. And that wasn't paid time. So I just gave her a bonus on her next paycheck. Or, I have a staff member who's really taken this whole frenectomy thing on board and she really like likes it and takes time to look into things about it and help, and I give her a little bit extra each time that I see a review with her name on it. I give her something extra.
Hmm.
So I think making sure that each person feels like they're being seen is an important part of my vibe too, including my staff, including parents, but also my staff, and just thanking them for verbally. I think that's what all of us want, is to be recognized and seen. And I make an effort to genuinely do that as much as I can.
Yeah, that's interesting. I like that. I like that throughout the whole year, you kind of like give them a little bit or a
Yeah.
lot of bit of, like affirmations and praise. And you're like, hey, I see you. So I like that. But
Yeah.
alrighty, Yosh, thank you so much for being with us. It was a pleasure. But before we say
Yes.
goodbye, can you tell our listeners where they can find you?
Sure. I own Viera Pediatric Dentistry in Viera, Florida. You can follow us on Instagram at Viera Pediatric Dentistry. Our website's vierapd.com. And you can reach out to me via PM or DM or whatever. I'm very accessible. So if you have any questions specific to my office or in general, I'm happy to help as much as I can. I'm an open book. So don't worry about reaching out, and questions they're all fair.
Awesome. So, guys, that's all going to be in the show notes below in case you're wanting to reach out to Yosh and then pick her brain, see what everything she has to say, what it's all about, and everything like that. So, go in the show notes below and definitely check that out. And Yosh, thank you so much for being with us. It was a pleasure. We'll hear from you soon.
Thank you, Michael. Have a great night.
Thank you so much for tuning into that episode. And Dr. Yoshita Patel, if you're listening, thank you so much for allowing me to interview you and conversate with you. I learned a lot from you, and I'm sure our listeners and our audience are learning a lot from you too. So guys, if you want to reach out to her, definitely go in the show notes below and check it out. Or if you want to continue the conversation, like I said, you can join the Dental Marketer Society Facebook group, and that's going to be in the show notes below as well. And you can talk to Dr. Patel there, or continue the conversation about this episode as well on there, or any episode that you find in the podcast. But thank you guys so much for tuning in. I truly appreciate it. It means a lot to me that you guys are listening and giving me feedback. I always want to hear from you. So definitely, if you have a request, if you have any questions, concerns about an episode or a guest, if you want me to hear any of your feedback, go on to thedentalmarketer.org and then click on connect and then write me there. So guys, thank you so much for tuning in. I truly appreciate it. And I'll talk to you in the next episode.